Thank you, Tim. I am very pleased today to present to you the top-line results from the single ascending dose component of our Phase 1 study in healthy volunteers. The data that I will share with you today are preliminary in that they are compiled internally by AdAlta from the study database that was reviewed by the Study Safety Monitoring Committee. Database lock and full statistical analysis is in process and projected to be completed in Q2 of this year, but we certainly do not expect the results that I'm presenting today to change materially. There are three key findings to share today. Firstly, AD-214 has an excellent safety profile when administered as a single dose at doses of up to 20 mg/kg. Secondly, the study demonstrated clear evidence that AD-214 engages its target, the CXCR4 receptor. And finally, that AD-214 engagement of CXCR4 was sustained at high levels for extended periods. Using these results, we have redesigned the remaining Phase 1 program to explore more clinically conveniently and longer dosing intervals and to ensure delivery of a Phase 2 IND-compliant safety package applicable to multiple indications more efficiently. So 42 participants completed Part A of our study and received single doses of AD-214 or placebo at 0.01 milligrams per kilogram to 20 milligrams per kilogram. The primary objective of the study, as is the case with all first-in-human studies, is to establish the safety and tolerability of AD-214, with secondary objectives to explore pharmacodynamics, pharmacokinetics, and immunogenicity, and exploratory objectives to investigate potential pharmacodynamic markers that we can use as indicators that AD-214 is engaging its target, CXCR4. The study was conducted at two clinical sites in Australia, CMAX in Adelaide and Scientia in Sydney, and 3D, our bioanalytics were completed by 360 Biolabs in Melbourne, and CNS, now Novatech, was our external clinical research organisation responsible for monitoring our study. As was expected from our preclinical studies of AD-214, our Phase 1 study demonstrated that in the single dose setting, at all doses examined, AD-214 was extremely well tolerated. Even at our highest dose planned for the study, 20 milligrams per kilogram, we observed no dose-limiting adverse events. There were no serious adverse events reported, and overall, the spectrum of adverse events that were reported were unconcerning and all were reported as mild, with the exception of 3 events that were reported as moderate. In terms of immune response, while we did see a few isolated and minor instances of cytokine elevation in some participants, we saw no clinically significant cytokine release, which indicates a lack of concerning inflammatory response. Anti-drug antibodies were detected in 11 participants, which is unsurprising for an antibody-like molecule, but these were not reported to be associated with any clinical symptoms and were predominantly low in titer. As per preclinical studies, pharmacokinetic studies measuring the concentration of AD-214 within the blood demonstrated that maximum exposure, or Cmax, increased in a dose-proportional manner, while total exposure, or AUC, increased in a more than dose-proportional manner. The elimination half-life was predicted to be approximately 44 hours. The AD-214 target, CXCR4, is expressed on fibrotic tissues in disease, but it is also expressed normally on white blood cells in healthy individuals. Physiologically, AD-214 engagement of CXCR4 receptors on white blood cells would be expected to cause transient increases in their levels. Certainly this was observed in our preclinical studies, and it was also observed in our Phase 1 study, where dose-dependent increases in white blood cells, including blood stem cells designated as CD34 positive, was seen for all doses of AD-214 administered. This transient increase in white cells is clear evidence that AD-214 is actively engaging its target, CXCR4. STF1 is the natural ligand of CXCR4, and engagement of AD-214 with CXCR4 should, as we saw in our preclinical studies, transiently increase plasma levels of STF1. As expected, we observed statistically significant and dose-dependent increases in STF1 levels at doses greater than 5 milligrams per kilogram, equal to or greater than 5 milligrams per kilogram. Again, this again confirms engagement of the CXCR4 receptor by AD-214. Ultimately, the CXCR4 receptors that we are interested in from a clinical point of view are those expressed in fibrotic tissues. However, as I mentioned before, CXCR4 is also expressed normally on white blood cells. Measurement of AD-214 occupancy of the CXCR4 receptors on white blood cells therefore provides us with an easily accessible tool to explore the relationship between doses of AD-214 administered and receptor occupancy. These investigations were firstly carried out in non-human primates, and the results of these preclinical studies indicated that all doses of AD-214 administered were able to bind CXCR4, and that the percentage of receptors that were bound and the duration that the receptors were bound was dose-dependent. In the non-human primates, 80% receptor occupancy was only seen at doses equal to or greater than 30 milligrams per kilogram. At 100 milligrams per kilogram, the highest dose of AD-214 administered preclinically, greater than 50% receptor occupancy was only sustained for approximately 4 days. In this aspect, the results from our healthy volunteer studies has exceeded our expectations. You can see from the graph on the left that at all doses of AD-214 administered, even our lowest dose of 0.01 milligrams per kilogram, we were able to achieve greater than 80% receptor occupancy immediately after infusion. Again, the duration of receptor occupancy was dose-related. At 5 milligrams per kilogram, the green line on the graph, 1 week after administration of AD-214, receptor occupancy was at 75%. 1 week after administration of 10 milligrams per kilogram, the blue line, receptor occupancy was above 80%. At this point in time, because these findings did exceed our expectations, we had to submit a protocol amendment so that we could explore occupancy of the CXCR4 receptor by AD-214 over longer periods of time. Data demonstrates that at 20 milligrams per kilogram in brown, 1 week after administration of AD-214, receptor occupancy was still at 100%. 2 weeks after administration, receptor occupancy was still above 60%. If this data can be replicated in the diseased tissues of patients, it indicates that even though AD-214 is quite rapidly cleared from the plasma, receptor occupancy and thus the pharmacodynamic effects of AD-214 may be sustained for significantly longer. So, where to next? Our original phase 1 study had planned on completion of Part A of the study to move directly into patients, first in the single dose setting, Part B of the study, and secondly in the multiple dose setting, Part C of the study. However, it's important that we use the information that we learnt from Part A and also to respond to increasing interest in AD-214 in multiple indications. So we have therefore redesigned the remaining phase 1 program. Part B of the current study will now be a multiple ascending dose study in healthy volunteers. Due to the excellent safety profile we have seen in Part A, we have submitted a protocol amendment to remove the 1 milligram per kilogram cohort and begin dosing at 5 milligrams per kilogram. Due to the sustained receptor occupancy, we have increased the dosing interval from weekly to fortnightly and decreased the highest dose administered to 15 milligrams per kilogram. Moving to a multiple ascending dose study in healthy volunteers also allows us to include a placebo arm, which further strengthens the study and facilitates the completion of an IND-compliant Phase 1 safety data package applicable to multiple indications more efficiently. The ILD patient component of the previously planned study has now been moved to a new Phase 1b protocol, which will be initiated concurrently with the healthy volunteer multiple ascending dose study. This new Phase 1 study will be in 2 arms. Arm A of the study will enrol up to 12 patients with various fibrotic indications and will incorporate radio-labelled AD-214, which is currently under development, to facilitate an exploration of AD-214 distribution in the fibrotic tissues by PET-CT imaging. Arm 2 of the study will enrol up to 6 patients with interstitial lung diseases to receive up to 6 doses of AD-214 at 5 or 10 milligrams per kilogram. This study, as well as looking at the safety, pharmacokinetics, pharmacodynamics and receptor occupancy of AD-214 in a multiple dose setting in patients, may also allow us to gather some very preliminary data on the potential effect of AD-214 on lung function. Thank you all for your attention, and I am very pleased now to invite Professor Glen Westall to provide an update on the clinical landscape for IPF and the potential for a CXCR4 antagonist such as AD-214 as a therapeutic.